Hello and welcome to Medical Dialogues. I'm Roshni Dhar, and today we're going to talk about the issues that junior doctors are facing in the country, especially the mental health issues and violence against young doctors. To talk about this in detail, we have with us today Dr. K M Abul Hasan, who is the National Chairman of IMA Junior Doctors Network and State President of IMA Tamil Nadu, and also a pediatric surgeon. Welcome to Medical Dialogues, Doctor.
Thank you for the opportunity.
So, Doctor, as we know that mental health is an important issue for junior doctors, and IMA JDN took the initiative to launch a supportive system to address their mental health. And also, the workload for junior doctors is always instrumental for health issues. So, can you please share your views and what would be the solutions according to you?
There are two areas where the mental health, is important. One is the number of working hours that people are undergoing. Another is departmental toxicity, that is workplace bullying and discrimination, and also toxicity. Because of these things, of late we come across many very sad instances of our postgraduate residents and medical students committing suicide. So we have started a 24/7 mental health helpline from IMA JDN platform. It was launched in December last year by the National President. Till now, we have 22 residents under counseling. Those who complained of suicidal thoughts and suicidal tendencies because of problems they face in the department. So I think this is very, very important that the people now get stressed. Even myself, I have personally intervened in many institutions, talking to the deans and the head of the departments when we get complaints from the students. And many of the time they got rectified. People become less stressful and comfortable. But sometimes, people don't seek advice, even from the peers, from the friends, from the family. So they take a very unfortunate decision of ending their lives. So this is very important that all the medical institutions in the country should have mentorship program. It is already there, but it's not implemented in 100% in all the medical institutions. Mentorship means every student will have a senior person as a mentor. So there will be a collaboration, coordination from the day of joining till they finish their career course in the particular college. But this is not 100% working now. So we have taken it up with our medical commission when we had a meeting recently. They assured us that the NMC would monitor this mentorship program in the campuses very seriously hereafter, and also address complaints whenever they receive it from the affected students, affected residents. They will address it. So we have to be on our toes to kind of address these mental health problems by varieties of means, by having this helpline and also sensitizing the authorities that the people are getting more stressed in the departments, maybe because of the workload and also because of the bullying in the department or toxicity in the department. This is one of the very important and priority number one work IMA JDN is presently doing.
Right. So, Doctor, health is a right, we all know that, and health is ignored and compromised as well as by doctors. So, what would be your suggestions or appeal to individual doctor?
Yes, a doctor is a messenger of health, isn't it? So, we have to be the example for the other people, the society to follow. There are three important things like having good lifestyle. Lifestyle means getting up and sleeping at correct time. That is number one. Number two is having a healthy food, avoiding junk food, having only very nutritional food is number two. Number three is physical activity. Physical activity throughout the year, not in 1 month, not in other month. So these are the three things we will have to strictly follow. We have been doing lots of programs in all these areas and creating awareness among the young doctors, particularly, to follow this and maintain a good health. We have also done varieties of sports activities, sports competitions, and also fine arts competitions, singing, dancing, and workshops are being held in these areas, keeping them kind of very cheerful and also healthy. And also we have been advising our people to be less on alcohol and tobacco, and we all know that they are the main killers today, and many of the young people have died because of this addiction to tobacco and alcohol today, and also the substance abuse. So overall, a doctor has to be the example of maintaining health. So this is our another priority area that we have been advocating kind of guidelines. We have even given a book format to all the students how to maintain their health, particularly during exam times. During exam times, people will not sleep, people will not take adequate food, people will be kind of depressed, anxious. So how to overcome all these things? We are giving instructions to people to maintain health during the stressful times and also non-stressful times.
That's right, sir. So, as being the national chairman of IMA Junior Doctors Network, what would you like to say on the national policy of Junior Doctors Network to get rid of this situation?
Yes, there are very important things today to be addressed by the government because we are producing nearly 107,000 MBBS graduates every year from 730 medical colleges across the country. There are two important things. One is their career. Career means, what I say is, it is not about the money. It is about the honor and respect they are going to get in our country. To address this, we have envisaged a program that is called the Young Doctors Employment Bureau that will be launched soon from the IMA headquarters, probably on July 1st, where all the young doctors means who are 10 years after their registration, after their MBBS, finishing their MBBS course and registration in the council. Within 10 years, they are called young doctors or junior doctors. They can register this Employment Exchange Bureau, both for the domestic opportunities and also overseas opportunities, and also career facilities that they can get. Specialized training abroad, that also will be done or helped through this Employment Exchange Bureau. I think this is one of the important areas government will have to support us. Second thing is their skills and career are very important, and also their mental health are very, very important, and they should address it because they are the future of our nation. And we have been meeting NMC, National Medical Commission, and DGSS very frequently now, taking up all the issues with regards to young doctors. And we have also met many of the candidates who contested in the recent parliamentary election about the issues of young doctors, their mental health, their problem of ending their lives by suicide, their career opportunities. So I think the new government should give utmost priority to solve these issues. And they are the strength of our nation. They are going to be the healthcare providers for the future of our country, and they have to be healthy and strong. So we will definitely make them introduce schemes and projects to have their mental health in check, and also their working hours particularly. And this is very, very important that we have also represented to the National Medical Commission that there should be strict guidelines for the working hours of residents in medical colleges, hospitals. Up to only they should work only 8 hours a day with a post duty off or weekly off, so that the stress will become less. Because during their working hours, they have to address, they have to provide health care to the patients in their work, and also prepare for exams. Both of them, they have to do it simultaneously, so they will be overstressed. So this is one important thing causing their mental agony and also mental health problems. So I think the new government will talk to the NMC and develop a good policy of addressing this issue of fixed working hours for the residents in the medical institutions, and also taking care of their challenges they face, like discrimination, bullying, and also departmental toxicity.
So, what would be your appeal to authority or policy makers to bring the change?
Yes. Also, I would like to add one important thing here, that now the present generation doctors are are very skillful, very, very knowledgeable, and they are very smart, and they learn things very quickly, and they are very much sympathetic towards patients and their diseases. Only thing is, these kinds of, I think it's underutilized by the association, also by the government. So I think government must create more jobs in their sector, government sector, and also encourage entrepreneurship among the young doctors, and help them create their own medical establishment. These are the important areas that we should have, a government should cover. I also wish to tell our young doctors one important thing, that you have to follow 5 important principles in your career. Number 1 is, medicine is a very fascinating field. Do your job joyfully, enjoy your profession. Secondly, learning is a continuous process. Learn every day. Third, and most important, is you are a professional, so you should follow ethics, morals, and values, and live like a professional. Number 4 is contribute to the society as much as you can. Okay, and fifth one, and the most another important one, is remember that you are the important citizen of this country. So connect yourself to all the issues that are facing our nation, and everyday issues are your issues. So connect to the society and contribute to the solutions which are necessary today.
Well, right, sir. That's very well said, that learning every day is very important. Thank you so much for your insights, and thank you so much for being on Medical Dialogues today.
Thank you very much.
That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.